Welcome to Holy Health, the podcast where cutting-edge health insights meet timeless biblical wisdom. Join us as we explore the latest in wellness, fitness, and mental health, all while grounding our journey in the spiritual truths and guidance found in the Torah. Whether you're looking to nourish your body, mind, or soul, we'll help you live a life of balance, vitality, and faith. Tune in to discover how to achieve holistic health through the perfect blend of modern science and ancient wisdom. Let's dive into the fullness of life, body, and spirit together. Hey guys, welcome back to the Holy Health Podcast. I am really excited to bring you guys this week's episode with Dr. Miri Ben Ami on the topic really of hormone replacement therapy. We've been fortunate to have several menopause experts on this podcast before, but I have been getting so many questions from so many of you about hormone replacement therapy and questions about menopause. And as much as I'd like to think I'm an expert, I'm totally not an expert. So I realized that I needed to find one. And it's thanks to my friend Heather, you guys will hear that I actually found Dr. Ben Ami. And I have since recording, and I would say it's not too bad. We probably recorded this episode about 2 months ago. I still have a couple things sitting in the files waiting to be released. So 2 months isn't that bad. But I have actually since visited Dr. Ben Ami myself, and it's amazing because it is personalized care. You know, I went with a friend. We were given 2 different prescriptions to do things differently because at the end of the day, everybody's body is different, and there is no one thing that is 100% right for every person. And at the request of Dr. Ben Ami, this podcast is actually going to be audio only. And I hope you guys will enjoy it. So if you're on YouTube, watch it on YouTube, listen to it on YouTube, or any of our podcast apps. And while you are there, please hit that follow button and send this on to friends of yours who you think could enjoy this. And I'm really excited for you guys to hear this week's Torah Extra with Chayala, who joins us all the way from Florida, thanks to my friend Lillian, who put us in touch with each other. And I think you guys will be hearing from Chayala on another episode as well. She and I are going to do an interview about some of the things that she does in her work. And I think you guys will enjoy that as well. So on to the episode, and I'm wishing you all a Shabbat Shalom. Hey guys, welcome back to Holy Health. I know it's been a minute, but I'm really, really excited to be back. Especially can't wait for you guys to hear today's guest. Today's guest is a powerhouse in women's health with a career that spans continents and disciplines. Dr. Miri Ben Ami is a seasoned expert who completed her medical studies and gained experience in women's health during her residency in obstetrics and gynecology in South Africa and the UK. But her expertise doesn't stop there. She's deeply passionate about menopause and women's health, earning advanced certifications from the North American Menopause Society and in weight management from the World Federation of Obesity. Dr. Ben Ami also holds a certification in medical hypnotherapy, bringing a holistic approach to her practice. Beyond clinical work, she's made a significant impact in the world of biotechnology, leading research efforts and helping to bring new treatments through FDA approval to patients worldwide. With her vast experience in clinical research and her unwavering commitment to empowering women through education and menopause, Dr. Ben Ami is dedicated to ensuring women can live long, healthy, and vibrant lives. Let's dive into her expertise and learn from one of the leading voices in the field. I'm really excited to welcome her today. Hi, Dr. Ben Ami. I'm so excited to have you with me here today. Thank you so much for agreeing to do this.
Thank you, Dara. I am so happy to be here. Thank you for inviting me. This is such an important topic. It would be great to empower women with the details that we need to know to have really great lives in menopause as well.
I agree. And this is something people are asking me questions about all the time. And I have to I like to sometimes give shout outs. One of my best friends, Heather, who was actually the one who found you. And so I have to thank her for actually finding you so that, it made me reach out to you. And I'm just so happy I did. And I'm so excited to hear what you have to say.
Thank you.
Okay, great. So first of all, let's just start with, what do you do?
almost 30 years ago, when I was in obstetrics and gynecology residency, I had this wish. It actually came from a brilliant TV series with the same idea. I was hoping that one day I'll open a clinic for women, that they'll be able and comfortable to reach out with issues they have, hormonal issues they have, that they feel might have been overlooked, stigmatized, undertreated. I can think of an example from my clinic. A woman who came to me, she was in her early 40s with 8 children. She was feeling extremely tired with some perimenopausal symptoms, and she was trying to conceive for a few years with no success. The doctors she went to told her that her fatigue was natural, expected with 8 kids, and hinting that another child isn't going to be the best solution. So I saw her and realized that what was going on was that she had thyroid issues. And thyroid issues, it's very, very difficult to fall pregnant with them. And she was also starting to transition into menopause. So treating her for her thyroid problems and perimenopausal symptoms, she felt much better. And there was a bonus as well. She fell pregnant. Today, with 9 children, she is so much more energetic. She's healthy. She's happily traveling through her menopause transition. So unfortunately, even today, there's still a complete discrepancy between the wonderful treatments that we have available and the care that most women receive.
So let me ask you, let me back up for 1 minute and let's talk about like what actually is menopause and what does it mean, if somebody's in menopause, what does that mean?
Medically speaking, it's really easy. The period stops for 1 year, period. Okay. So that's medically. But to get into the deeper meaning, menopause is me, no pause. Life continues, doesn't stop for a moment. And all that really happens is a shift in the emphasis of what our major role is. So moving from a more reproductive role to a more advisory counseling role. So if I go into Jewish writings that we can learn so much from, in Pirkei Avot, in chapter 5, it teaches us what our main mission is for each decade. So it's also true for men, but it's much more striking in women due to the hormonal roller coaster we go through from puberty to menopause, unlike men who have an easier ride. It goes like this. I'll start with the 20s. So the 20s are for our pursuit, for pursuing. It means pursuing our mission in life, our livelihood, a partner. Those are the 20s. The 30s are years of strength. We know this is true medically because we reach our peak physically in our 30s. And in women, our monthly cycles is not a minor physical feat, not to mention also childbearing, which poses a huge physical load on the body, the bones, the lungs, the heart. Just to give a small example, for women in pregnancy, heart output and blood volume increases by as much as 40%, which is a huge physical change. The 40s, it says, is for gaining understanding and wisdom. And then the 50s, this is around menopause. That's the age of counsel. So menopause is essentially when our physical roller coaster ride is done. Our bodies can now rest from the major physical task of monthly cycles and childbearing, and our role shifts to a more counseling and advisory role. So we really, it's important to keep that in mind also when discussing treatment for menopause, because one of the major benefits of hormone therapy is preventing cognitive decline. And hormones can really help us stay sharp for our counseling role.
Okay, that's great. So let me ask you, how does menopause typically progress? I guess in terms of symptoms, what are people usually feeling? And like, are there different stages of menopause?
Okay, so there's the perimenopausal stage, and that's the most challenging part in the transition to menopause. The whole transition is divided into 10 stages. It's called the straw plus 10 staging. But that's only important if you're sitting for the menopausal certification exam. So we're not going to go stage by stage. The important thing to know is that perimenopause phase is similar to puberty time, with periods becoming irregular, heavier, lighter every week or once every 2 months. We know from puberty there are a lot of side effects as well that the younger women get. So this is essentially similar because the hormone levels become erratic. From puberty, they move from being erratic to being like a Swiss watch. In perimenopause, they move from being erratic to just complete rest for the body. So it's actually something to look forward to. What happens is that sometimes I think I can semi-quote Michelle Obama at the Democratic Convention when she said, so I'll use the hormones. It's when progesterone goes low, estrogen goes high. So it's completely one not balanced with the other, and it disrupts the fine balance between the two hormones and can lead to many, many symptoms that, we would need a whole day to even mention them. This stage can take several years.
I know you said there are so many symptoms that it would take us days to go through them. Could you mention some of the main symptoms that maybe people might be feeling and, that might make them realize, oh, maybe they're in perimenopause or in menopause?
Yeah, absolutely. There are about 70 different symptoms over the years. When I get new patients and I speak to them, if somebody comes with a really strange symptom, which I don't even think is even connected, and I see the hormones improve it tremendously, then I just add it. So I've come to about 70 symptoms, but there are probably more. To make a long story short, anything that changes, periods might even still be regular. So it's not mandatory that you cannot start thinking that you might be going into the menopausal transition if your periods are regular. It can also happen when periods are regular. Women come in often and tell me they don't recognize themselves, they don't feel themselves. That is a main alert that the perimenopausal or menopausal transitioning is starting. They can be more anxious, they can have panic attacks while driving, difficulty sleeping, lots of aches and pains, fast heartbeats, of course, hot flashes, but not always. So those are some of the signs a woman may experience entering into perimenopause, and anything that makes a woman feel like something is not as yesterday, not 100% right. And there are many, many things that one can take to help and alleviate these symptoms.
Okay, great. And I think you said earlier, is there anything else, that it sounds like a woman would know she's in menopause if she didn't get her period for a year, then she would know she's in menopause. Is there something else?
Yeah, so that's exactly right. In women with an IUD, or if they've had a hysterectomy, then one would need a blood test. Again, that's a way of for a woman knowing she's in menopause or even post-menopause. Okay, so it's one day after the year with no period. But again, perimenopause is even more challenging. So a woman can already start looking for any help she may need also in an earlier stage. For a woman who has absolutely no symptoms, nothing at all, it would probably be advisable when she is in menopause to go and consult and just to have a physician looking over her medical history, family history, if there are any risks involved. And that can be a good point to decide whether she needs anything to help protect her.
Okay, great. And why do you think there's so much stigma around menopause? It's only really recently that you start, that you really hear people talking about it. Why do you think there's so much stigma and shame around this stage in life?
I think menopause is directly related in our minds to aging. So men go through menopause, which is called andropause, but it is a slow process and it's not marked by a specific physical sign such as period stopping. So they can completely ignore it for as long as they wish, maybe buy a motorcycle or, do something like that. I think this is why it's important to understand the real meaning of menopause and that it does not define aging in women. Some women are in their 30s and unfortunately even before that when they get to menopause, and some are 60. I've seen the full range. So it is really not associated with aging. This is very, very important to realize that studies have shown that there is a huge surge in health risk, cardiac and metabolic, in the menopausal years for women. So whether the woman, even more so if a woman is menopausal at 30, okay? So we actually start nearing the numbers of men suffering from heart problems when we reach menopause. Usually men suffer more than women at the younger ages. And then when we become menopausal, we kind of start reaching their risks. So we should see ourselves as really being lucky to be women, that we can actually reduce those risks and even prevent diseases if we bring those protective hormones back into our bodies. I can say here also, if we look at the Jewish approach, in Dvarim, it says, "V'nishmartechem me'od lenafshotechem." It's a Torah-based obligation to guard our health. So commentaries guide us to guard from risks, and menopause treatment completely fills that obligation. So we'll get into that when we speak about the treatment.
Okay, great. Well, there's so many people in the world. It's so controversial, hormone replacement therapy, right? You hear all of these people who today, there are some people that are for it, and there's so many people who are quoting some study that I think was done years ago that showed that it would increase the risk of ovarian cancer. What do you think about this? Where do you stand on this?
But everybody's worried about hormones increasing risk of cancer, any cancer. And the big one was, in fact, the breast cancer. And that was because of the WHI study, the results coming out in 2002. And I want to say something up front. First of all, it's not a matter of opinions. It's not a matter of beliefs. It's really a matter of knowledge, okay? Knowing the data, understanding all the research from 1930 until 2025, okay? I will tell you a bit later when we talk about the benefits, not the risks, about a study that just came out in 2024. And I want to say that no study contradicted another study. We are just getting more and more confirmation of what we are learning as we go along. So if somebody asks me, do you believe in hormones? I will normally say, I believe in Hashem. I believe in my family, in my children. And hormones, it's got nothing to do with opinion and beliefs. It's really understanding. What we need to understand is that some hormones increase risks for breast cancer, for strokes, for heart attacks, from thrombosis, and others protect against cancer and breast cancer and heart disease, osteoporosis, dementia, and so much more. Some hormones may lead to weight gain, and some hormones lead to weight reduction. So I'll ask my patient what she wants, and I know what she'll tell me. Even my underweight patients, right, that's what they want.
Nobody wants to gain weight. Yeah.
Nobody wants to gain weight. Some cause abortions and some help to get pregnant and maintain pregnancy. So it's a really, really important, it's really important to understand which hormone does what. So the results came out in 2002 from a study that tested fantastic study. It added information. It tested MPA, a synthetic progesterone, and estrogen, CEE, which is a synthetic estrogen. And it showed that the estrogen arm increased thrombotic events, strokes, heart attacks. And we learned that synthetic estrogen, when given orally by swallowing to women who are 65 years old, was a very bad idea. And that's not done anymore. Okay. And following this study, we even have now in 2004, FDA approved a transdermal, a skin estrogen, which was shown not to increase those risks. With the breast cancer, that was in the arm with the synthetic progestin, and it showed that those women who were getting the progestin, well, there were more breast cancer cases, and MPA is hardly used, if at all, for menopausal patients. So there are other synthetic progestins that are used here and there, because very difficult to change protocols. But the natural progesterone, since 1980, when it was approved, hasn't shown any risk in increasing breast cancer. So again, like I said, it's really, really important to gain knowledge from each study and know how to differentiate between the different types of hormone. So in a woman with a family history of breast cancer, heart disease, or she herself has like a coagulation clotting problem, hormones need to be carefully fitted, and she should receive these hormones that protect against these risks. Talking about risks, I'd like to add some important information that I find is not well communicated. HRT with synthetic progestins increases the risk of breast cancer by 4 additional women getting breast cancer out of 1,000 women in 5 years. Okay, so remember that number, 4 additional cases.
Okay.
You have an idea of how many additional breast cancer cases we will have in women who suffer from weight gain and reach a BMI of 30 and up. So we have the 4 additional cases with progestin.
Okay.
With women who have gained weight in menopause, which is
most women.
Yeah, it's a BMI above 30 and 60 years and older. It's almost 60% of women.
Wow.
There's an additional 24 cases of breast cancer. So with the bad hormones, there is 4 additional patients, and with BMI of 30 and up, 24 cases. So it's 8 times more the risk of gaining weight than with the inverted commas bad hormones. And this information is not even communicated out there. So women are not given the chance to prioritize also what is better for their health. So I just wanted to get that in as well.
Yeah, so I might be sort of going over what you said, but when I heard you talking about the non-bioidentical, like the artificial, that wasn't the word we used, but the manufactured or the not real progesterone, we also said that was what was in Mirena, or that's what's in the IUD. Should people be worried with an IUD about a possible increased risk of breast cancer? And I bet it likely says that on the pamphlet that nobody probably reads.
Yeah, so the pamphlet is an important issue to discuss as well, because it's the same pamphlet that goes right across all medications: bioidentical, natural, synthetic, riskier synthetics, less risky synthetics. So it's just a one size pamphlet.
Okay.
The bioidentical compounded hormones would need such a pamphlet if they were regulated. So for the compounded hormones, it would be exactly the same pamphlet. The thing that happens is that they are not regularly required to have such a pamphlet. Okay, but it's still the same pamphlet. So Mirena, and that's why it's something I don't want it to come across as if it's a risky treatment. Okay. It's local, It's in the uterus, and studies are not absolutely unequivocal on this matter. So it's nothing has shown us that we really need to start taking Mirenas out, and it's not something to worry about. But also understanding the difference between the bioidentical and the synthetic. So understanding if women do need a synthetic hormone, then all the risks around need to be taken into account. And in every single case, always the least riskiest treatment should be given. In menopause, there is no compelling reason not to go and have the natural hormones, the approved bioidentical hormones. There's also a place for compounded ones, and that's when if a woman has lactose intolerance, if she's allergic to one of the excipients of the bioidentical hormones that are in normal pharmacies, or if sometimes I need a lower dose than what is available in the HMO, the Kupot, and then I will also compound the dose if I need a lower dose. So there's really room for everything. And it's so amazing that we are able to help women, and even risk-free. If we just, I can say maybe to summarize it is mostly using the bioidentical, natural, approved hormones, compounding done only when medically indicated. The bottom line being that we treat in the right dose, the right balance between hormones, the right formulation, oral or skin, for the right woman at the right time, considering all the individual medical aspects, and quite important to go to physicians who have specialized in menopause, because really all the data is there, and we need doctors who have dedicated their time to this niche in gynecology, will understand all these different factors. I think it's so much to expect any woman who has her own livelihood, her own role, and she's so busy, to expect all women to start getting into the nitty-gritty, in-depth information of all the hundreds of wonderful hormones that we have. I like teaching my patients that vitamin D is a hormone. Okay, vitamin D is a steroid hormone. So nobody knows that. So anybody who comes with a question, do you believe in hormones? I don't want to take hormones. And obviously these are actually intelligent women who take care of their health, and that's why they're scared to take hormones. So they are on vitamin D, and then they're sort of very, very surprised that they didn't know that vitamin D is a steroid hormone. It was discovered after vitamin A, B, and C. So the doctor, Macaulay, I think his name was, who discovered it, simply called it vitamin D, but he didn't, he wasn't sure at the time whether it was really a vitamin or what it was. So it's really up to the medical community to help, and once women know that there is treatment, risk-free, catch-free, just to find the right practitioner who can give the right treatment.
Okay. So we talked about all these negative aspects, things to be worried about. So what are the actual benefits of hormone therapy? How do they help us?
So hormone therapy is essentially our fuel. I always say that I run a fuel station. Women's life expectancy is higher than men's, around 4 years, and it's thought to be in a major part due to the protective function of female hormones. Hormone replacement therapy maintains this protective advantage through the years in post-menopause. We've seen this in the study that I said I'll mention, that the results came out in May last year. It was the largest epidemiological study ever done in postmenopausal women over the age of 65. It was performed by US National Institutes of Health, and it looked at 10 million women. So it compared those who have been on menopausal therapy for several years and those who did not use HRT at all. In the hormone users of estrogen alone, there was a close to 20% reduction of mortality from medical diseases.
Wow.
So it's a huge amount of mainly cardiometabolic, 11% reduction in heart attacks, unbelievable. Breast cancer, it showed a 16% reduction. Okay, so we are taking out the progestin, which increases, and we looked at those patients who did not receive synthetic progestin, and that reduced breast cancer by as much as 16%. There was also a 13% reduction in lung cancer, and I'm going through those that I can remember because I get excited every time I think about this. There's a 12% reduction in colon cancer, a 3% reduction in thrombotic events, and 2% reduction in dementia. So if you remember our counseling role, this is critical. Now, dementia comes at very, very high percentages, okay? Millions more with aging can suffer from dementia. So the protective role, reducing those huge numbers by 2% is already a huge benefit. So in the study as well, looking at the estrogen and progestin arm, there was a significant reduction in endometrial cancer. If I remember, it's around even 35%. There was a 25% reduction in ovarian cancer, something we discussed previously.
Right.
And also in heart disease and thrombosis. In addition to that, we also know from many studies that hormone therapy significantly reduces the risk for osteoporosis. And it's even, FDA normally get an indication for medication for cure or treatment. And here they gave hormones a preventive indication, which is fantastic. Maybe it will come in the coming years also for prevention of heart disease. But right now we have hormone therapy as an indication by FDA for prevention of osteoporosis.
Yes, I wanted to just tell you, it's very interesting. In the past year and a half or so, I had at least 2 or 3 people who are personal trainers, women, who came to me because they were told they have osteoporosis. And they came to me, they all lift weights, and they came to me, thinking maybe they needed to lift more weight, or maybe they were doing something wrong, or they weren't doing it well enough. And I said to all of them, do you really think you're not lifting enough weights? I'm not saying that lifting weights, I lift weights. I believe people should lift weights. I'm not saying that lifting weights doesn't help prevent osteoporosis, but clearly that's not enough. I said, I think you need to, talk about hormone replacement therapy and go see somebody. So I was really happy to hear you say that now about the osteoporosis.
And I think we deserve this. I heard of someone who went to her doctor, and she told him she has a lot of issues, and he said to her, well, you need to run many times around the block. And she says, oh, well, something easier. And says, you need to lift weights. And says, something easier, you need to stop eating so many carbohydrates. And says, no, can't you just give me something? So I think we really deserve to give ourselves something and not just put everything on our shoulders that and it's there, so not just think that we need to do more in order to get healthier. Sometimes we really can just take something. So about that,
Well, what about people that are having really bad symptoms in perimenopause as they're going through menopause? Can hormone therapy help people with these symptoms?
With absolutely every single one of them, the normal classic symptoms, and also the strained ones that I was talking about, like a woman coming to me with a chronic cough, and all the pulmonologists trying to help her, and couldn't find what was wrong with her. She started hormone therapy. I didn't make any promises that her chronic cough was going to disappear. It's less my area, but it did. It did.
Oh, wow.
So anything that, goes haywire. A patient had a pacemaker put in when all she was having was menopausal palpitations. So once she got hormonal treatment, estrogen, progesterone, that came out. Women getting frozen shoulders and getting steroid injections. Sometimes just some hormone replacement therapy fixes that. It's like I said, we really, it's like a fuel station. So our body is a vehicle which carries our soul. And so it's tougher for us as menopausal physicians in perimenopause. I find that I have to go on the roller coaster with my patient because it changes. So sometimes, and I give specific instructions, how much estrogen, how to take it, when to take it, how to increase the dose, depending on where she is on her roller coaster. And with progesterone as well, with that just goes down. It's not too much of a roller coaster, but it doesn't balance the estrogen. So perimenopause is really doing it slowly, listening to one's body and getting instructions on how to alleviate absolutely every single symptom. In postmenopause, it's much easier because in postmenopause, the roller coaster is over. There's just no fuel in the body. So women can be working or functioning on fumes. So that's really easy. You just give everything that's missing, and then everything is fine. A menopause specialist will know exactly, just by taking a proper history and medical status, what hormone is required when.
And do you do sometimes give people estrogen even before they've reached menopause? Because I was told, no, only progesterone, no estrogen until after menopause. So you're saying that's not necessarily true.
Yeah. So if a woman is having, I'll go extreme, but it doesn't have to be so extreme, but just to put the point across, if a woman in perimenopause is having terrible hot flashes, night sweats, and she's not sleeping because of those night sweats, and it might be happening before her period, or it might be happening here and there, it would be not very kind to just say, well, you still got enough estrogen. You've got this roller coaster of estrogen going up and down. So you just have to handle those night sweats. So you give the estrogen in the right formulation, in the right way. All is available in normal pharmacies. And in a way, for that, the gel, which is available, is very good because you can take a quarter of a ruler. They put the ruler in with the gel. So you can work out a quarter of a ruler up to a whole ruler plus. And I can work out with my patient exactly how she needs it, so she can be in perimenopause with enough estrogen here and there and still not suffer all those symptoms. So I have to really examine. It's not, again, so it's not a matter of age or just blood tests or what you see or what you examine. It's what your patient is going through, not only when she's at the clinic, and I've had to give some estrogen at the clinic when somebody was having a serious sweat and was very scared of hormones. So I some maybe offer coffee, and sometimes it's rare, but if it's really serious, I offer. Like, okay, well, I've got a bit of estrogen here. Let's put on your arm, and then they, oh, really? This is the hormone, the really bad hormone everybody's talking about. But so there are no protocols. Okay, it's very individualized. It's very specific, and research explains to us very well how we can calm down the roller coaster ride to a much more fun and calm ride. Oh, and that, after speaking about all the benefits, we can keep in mind that while we resolve those symptoms, the hormones are already hard at work to protect and strengthen the body throughout the process.
Okay, so just lastly, can you tell me like different symptoms? Let's say someone who's having trouble sleeping at night. I guess you already said estrogen will help with the hot flashes and night sweats and things like that. But what about like if you're not sleeping well at night? Is it progesterone that helps with that? Is the different symptoms, which are the hormones that maybe somebody just in their own head could figure out what they might need more of?
Okay, so even that is not a very simple, straightforward answer, and it would be different for each woman.
Mm-hmm.
And you're going into more emotional and mental health. So there are a few things with that, because sleep disorders, panic attacks, mood swings, irritation, focus, all the brain mental function
Mm-hmm.
is very affected in menopause. And so just to say that again, a lot has to do also with how a woman views and understands menopause. We spoke a bit about that, but
Mm-hmm.
I'd like to give some attention to the Japanese women. They call menopause konenki. Konenki translates to renewal and energy of life.
Mm-hmm.
So women in menopause are highly respected in Japan and are sought for. They're like the head of the family and work and whatever. And that's probably the reason that they're known to suffer less from mental issues. They have few physical symptoms which are easily resolved with hormone therapy. They live to 87, by the way, which is higher. It's the highest in the world. In the West, there is a higher incidence of all these mental health issues, and I think it's because of everything in our mind that is related to menopause. And the hormones really, really help with the anxiety, depression, the cognitive decline, attention deficit, poor sleep, mood swings, all of that. That can be resolved. And a lot of patients receiving, whether it's progesterone and estrogen, depending exactly on where the dysfunction is, a lot of them report that they're mentally more healthy, sleeping better
Mm-hmm.
than they've been in their premenopausal years. So for them, it's very surprising. And for me, it's not, because as women, we suffer from premenstrual dysphoric disorders, mental disorders, lots of other menstrual and hormonal mental health issues also during our fertility years. So once we're done with a roller coaster or all these ups and downs, which are normal in our fertility years, we can give the hormones in a very stable way. And just the fact that it is more stable helps with all these mental health issues and sleep and everything around that. I can also maybe add that stress, which is the century's pandemic, worsens the mental
Mm-hmm.
menopausal symptoms, especially, but it can also worsen other symptoms. And we know that stress is harsh with diseases also like diabetes, cardiac issues. We know about the broken heart syndrome. So when hormone levels, our fuel starts dropping, we are less able to cope with the stress. And today, unfortunately, here in Israel, we are at war with enemies on multiple fronts. Our stress levels are unbearably high. Women in Israel who are in perimenopause and menopause during these harsh times could use as much fuel as they can get to help get through these times and to be able to continue functioning meaningfully through each difficult day. So sometimes it depends exactly on where on that roller coaster ride a woman is. Those are the straw plus 10 perimenopausal staging. We know whether she needs only progesterone or whether she needs a little bit of progesterone and a lot of estrogen, and how to taper these doses up as needed.
Okay, well, all of that, everything you're saying makes a lot of sense. So, in that case, can you just explain the difference between bioidentical and compounded and synthetic and patches and all of these different ways and creams and all of these different ways of getting hormones? And is there something you recommend more or, to individual for each person?
So for menopause, natural, bioidentical, approved, FDA approved, EMA, health authorities approved medications are widely available. And they have been shown to be also with better safety profiles, less risks, no risks even, protective of cardiometabolic risks and other risks, and also more beneficial. So those are usually the ones that are used. There are a lot of different types. So, for example, the patches, there are patches with just bioidentical estrogen, and there's a patch with the bioidentical estrogen and a synthetic progesterone. There are half biologically identical hormones that have a place as well. Normally, the available bioidentical hormones are good, the natural ones. The compounded, I will use essentially if somebody is allergic to any excipients like lactose, whatever else, gluten, maybe soya, whatever one puts in the excipients, or if I need a very low dose. So those are the times I would use a bioidentical hormone. Or, for example, if a woman needs testosterone, there is a myth. Not all women need testosterone. But if a woman, after having her ovaries removed due to BRCA gene mutations, then she might need testosterone. Then I would compound something that is needed, indicated for a patient that is not available in normal pharmacies. But it's not a matter of all bad, all good. And it's also because if you take a bioidentical estrogen and you give it to a woman who's 65 to swallow, that can increase risks of thrombotic events. And so even, I always tell my patients, you need to understand the good things, okay? The natural, not good, but the natural hormones, natural treatments as well. If anybody goes to the field and finds a beautiful, beautiful mushroom and decides, wow, this is so natural, so beautiful, let me just eat it, okay? They can die. So not everything that's natural is fantastic. And understanding medically from evidence, from data, that's really the most important thing.
Okay. Well, so then my next question would be, do we take these hormones forever? Do you take them just for a few years? Do you take them forever?
Absolutely. The understanding that hormones that don't increase risks can be taken till the end of life, till 120, is getting more internalized. But what happens today is that a lot of women have been put on the synthetic progesterone that increases. We've seen it increases breast cancer after 5 to 7 years. So it's best not to go on it. But a woman that's already on them, the doctor will tell them to stop, which is a good thing. Unfortunately, they're not putting her onto something safer. So there are a lot of women suffering at the age of 60, 65, 70, being brought off their hormones. So it's very important to change to safer hormones, and then women can be on them forever. So if a woman is on good, safe hormones and her physician tells her she needs to stop because she's older, that is not good practice. patients really need to be on them for life. If a patient, a woman at the age of 70 feels like saying what she feels like without them, she wants to do a clinical study on herself, that's fine. I find a lot of my patients, if their mom is very, very healthy, I always ask if she's been on hormonal treatment, and 9 out of 10 times she has. So that's interesting. But usually hormones prevent the risks that get higher with aging. So it is a good recommendation to recommend to a woman, especially if she has family risks, to continue preventing them for as long as she needs to. So there's no problem with continuing for life.
Okay, one of the big things people tell me about, let's say someone has, you mentioned the BRCA gene, or they do have a history of breast cancer or uterine cancer or a family history. Do they need to be worried, or would it be okay for them to take hormones?
That's a big question. I'm going to separate it to two.
Okay.
Those with the BRCA genes, all professional menopausal international societies recommend to be on hormones. So, and even more so with early ovarian failure or BRCA, where there is the operation, the risk reducing ovary removal, and then she doesn't have her healthy hormones from a younger age. So all the menopausal societies recommend to take hormonal replacement therapy. And that's something that teaches us a lot, because even after removal of ovaries and tubes, breast cancer risk in these patients reaches as high as 50%, 50.
Oh, wow.
So when the risk is so high, the recommendation across these societies is that to take hormones, and they don't mention even specifically which ones, because the risks, the bone, the cardiac risks, the metabolic risks of not taking hormone therapy at such a young age are much higher even than the breast cancer risk, or at least survival is much lower from those diseases than from breast cancer. So this really teaches us a lot. With the second question, with patients who've suffered breast cancer, so some patients who've suffered from cancer, lymphoma, endometrial, ovarian, there are some cancers that is actually recommended to take hormone therapy because it reduces the risk of recurrence. With breast cancer, so this is I can say, still a controversial subject, okay, right. Especially when oncologists are trying to cooperate with gynecologists, with breast surgeons, and everybody sees their own area. So again, I'll move to the professional menopause associations. They today guide us that if we've tried other treatments for menopausal risks and symptoms and they haven't worked, well, it's not for menopausal risks, but it's mostly for menopausal symptoms, then even in a patient with breast cancer who suffered from breast cancer, we can very intelligently pick the hormones and choose the dose and start menopausal treatment with breast cancer patients in breast cancer survivors.
Okay, well, what about things that are maybe non-hormonal? I've heard about like different seeds you can eat or different essential oils that can help balance your hormones. Do you think this is a viable option? Do you think it should be an addition or not at all?
So there are plenty. A new one just recently was approved by FDA and EMEA for hot flashes. It's called Veoza. So a lot of work is being done out there to try and get non-hormonal treatments, and this is an approved one. The SSRIs are well known. They also improve depression. They are antidepressants. There are supplements, like you mentioned, phytoestrogens, Vitex, black cohosh, all those mainly used for hot flashes and less for the myriad of other symptoms. Hypnosis, I need to mention, because being a hypnotherapist has been proven. Okay, there's level 1 evidence that it works for reducing hot flashes. So it's important. So these all can be used, especially in menopause, perimenopause, when our body is still producing our hormones. Even then, and especially in postmenopause, they're all of them, also the new Verosa, all of them are less effective than hormonal therapy, even for hot flashes. And none of them provide the protective benefits to our health as hormones.
Okay, I think that's really important. What you just said, I think that's really, really, really important, because I've heard many alternative practitioners, touting the benefits of these other natural supplements and encouraging people never to take hormones. Now, I'm not a person that says never. I say you have to learn a lot of things and you have to hear everything. You have to speak to your own doctor or your own person, and you have to make your own decision. But I think that you just hit the nail on the head saying that they don't offer you the same protective benefits as taking hormones.
No. And this is evidence-based. So it's almost, as doctors, the first thing in our Hippocratic oath is do no harm. And that's harmful, because that's not understanding the oceans of data that's out there.
Right.
To say no hormones. Okay, so we need to ask them if they are talking about vitamin D as well, because everybody's in agreement that that saved lots of lives during Corona, and it's important for our immune systems and our bones.
Yes. Okay, so now what about lifestyle? What about health? What about food? The way people eat. I've heard so many different things. Can these things, like you talked about weight gain, things like that, exercising?
Right. So lifestyle is so important as an adjunct. The first and foremost lifestyle change is that it's time to care for yourself, do what you love doing, move like you love moving. So go out for a walk, smell the air, dance, swim, eat what you love. So all that goes a very long way to keep us healthy. With food, eating mindfully, no eating on the run, grabbing anything that's in front of us, or eating leftovers. Okay, I'm quite good at that. If we go to Jewish learnings around food and eating, I read something that was beautifully described by Rabbi Dr. Akiva Tatz in his book, World Mask. Food goes into our mouth, which is a place of connection between our physical beings and our spiritual being. So it's the organ, the mouth is also where we talk from, where we speak, where we give voice to our soul. And there's another connecting function that the mouth has. Do you want to guess what it is? It's kissing.
Okay.
So kissing is also a connecting act. So also when people connect with each other, it's always better over food. So I think if we understand this higher role of our mouth in connecting body to soul, we really will be more alert as to what we get in terms of nourishment. So thinking about what goes in our mouths, protein, calcium, but also not avoiding delicious foods, as long as we eat them mindfully and enjoying each bite. So really to think about that. It's not, menopause is not about avoiding the good life, preventing yourself from delicious foods. It's really being mindfully about how you respect that and enjoy it. So that's really important. And then I think because I'm treating women, It's very typical of us. We always have high expectations of ourselves. So one thing that we need to look into in our lifestyle, especially also in Israel during these difficult times, is to practice compassion and acceptance of one's own inner being. So to stop worrying about not doing enough or being enough, remembering enough, being strong-willed enough. I think if we all practice some compassion towards ourselves, this can strengthen our immune system and can in turn lower risks for so many illnesses. So just, there's the song, "Don't worry, be happy," that kind of thing. So it really helps a lot.
Okay, well, I'm getting down to my final two questions here. I know we've been talking for a long time. So what advice would you give a woman who's approaching or experiencing menopause? Is there something that you could say that might help them through this transition?
All menopause is, it offers a chance to reassess your health, prioritize self-care, rediscover the meaningfulness in one's life, trust your body. So, for example, if someone is gaining a few kilos, maybe your body is protecting you from osteoporosis, okay, which is absolutely can happen. So really to trust our bodies and to search for help when needed, with a goal not to just survive menopause, but to truly thrive through it.
Okay, I like that. That was great. Thank you. So the question that I like to ask every guest is, what does spirituality mean to you?
We are spiritual beings. We move around this world in a physical body. So our mission from a Jewish approach is to do good, to help one another, to make this world a better place. And by doing that, we are honoring God or a higher being who created this world for us. So we have the responsibility to take good care of this wonderful, complex vehicle carrier of our soul. And we really owe this to ourselves.
Well, that was beautiful. I love it. I think that everybody has a place in a way that they're spiritual. So I really liked that. Thank you so much for sharing that. And
Thank you.
I just want to thank you, because I know us finding this time wasn't so easy. And I know that you are so passionate about this and so passionate in helping women and helping them empower themselves, that I really appreciate you taking out the time to talk with us, to talk with me, and to give us all of this critically important information. Hey everyone, welcome back to Holy Health. I'm so excited. We have a new Torah expert with us today. Her name is Chayala Akerman. She's a family practice nurse. Okay, hold on. I said that wrong. She's a family practice nurse practitioner who specializes in osteoporosis and autoimmune health. She spent her career helping people find health through many different modalities and is excited to share her Torah perspective on this topic. And I am excited to hear it. And I just want to give a shout out to our mutual friend Lillian, who helped put me in touch with Chayala. And I'm excited to hear what you've got to say.
Thank you so much, Dad. This is really exciting for me. So thank you so much for having me on. I just actually started with something which I thought was cute, because at the end of every of your podcasts, you ask, what does spirituality mean to you? So I said, I'm going to flip it, and I'm going to start off with saying what spirituality means to me. Sure. And so to me, spirituality is taking the physical and uplifting it and making it spiritual and making it godly and holy. And so I have this story that I tell my kids all the time, and it's a story that really means a lot to me. Whenever I'm like going through something or trying to think of like how I can make something more spiritual, there is this story about a young Bachar many, many years ago in Europe, who was saving and saving and saving so he could get a hat. He wanted to buy a hat for his bar mitzvah, and trying so hard to get this hat. And he finally got it, and he was so excited about it, and everybody was celebrating because, back then it was hard to get anything. And then he had this hat just brand new, and it was, I think, a week or two later, the story goes that there was a Rav that came to the village and had lost his hat in traveling, and it was like a busha for the Rav to not wear a hat because like that is like a part of like the garb, you know. And so his mother, this young boy's mother, said, "Listen, you're just only like almost bar mitzvah. Can you try to see if maybe you can give the hat to the Rav?" And the boy was like toying with himself. And she said, "But if you give the hat to the Rav, you're going to have a mitzvah forever." Meaning this is a physical hat that you have, but if you give it away, you're going to have it forever. The hat will live forever if you use it for a mitzvah. And that is what I always think about when I have something or somebody needs something. I'll say, you know what, this, you know, the other week we had gotten a Shabbos special for a teacher that had injured themselves. And my kids are like, "Mommy, you never get a Shabbos special for us." I'm like, "Yeah, because I'm not getting a Shabbos special for me because that's expensive." I said, "But for a mitzvah, of course I would buy it for someone else, you know?" So that's what spirituality means to me. So in relation to our topic, I wanted to dive in to menopause and how I feel I interpret this stage of life to affect us from a Torah perspective. Interestingly, as I was looking into the Torah perspectives on menopause, there are very few sources for menopause in the Torah. But what I did really find was that menopause and the changes that we go through over these years of menopause, which is where we're letting go of our reproductive years and going into, you know, the years of post-menopause, it's a very big change for our bodies. And even though it's not something that I'm experiencing right now in my life, I treat a lot of patients who are going through menopause, post-menopause, and osteoporosis. That is a big part of postmenopausal changes. And so I really see that there is so much of a change that happens in our system in terms of our bodies and our hormones and everything changing. And I really felt when I was looking at this topic, it parallels so much the changes that we go through in our neshama over our life. And I was thinking about like the changes that happen in our bones and our hormones and the changes that happen in our neshamas. And as we go through life, we're always hit with different nisyonos. And it struck me many years ago that I was going through something and it just kept coming back in the form of a different person, a different situation. And I was like, Hashem, why am I keep getting this issue coming back all the time? And I didn't understand it until finally, like a wise woman who was a mentor of mine, she said, Chayala, don't you see? You're not conquering this nisayon. You're not conquering this issue. And so it's going to keep coming back to you until you conquer it and until you work through it. And I was like, oh, I get this, and it really sat with me. And I understood that like these issues, these transformations that our neshamos go through over our lives, it's Hashem's way of like that cycle of life, the cycle of how life turns is part of that. Our physical bodies and our spiritual neshamos, we have that cycle. And so to me, this change in life so much mirrors the changes that we go through in spirituality, and how those things will return if we try to just work through them. Then they won't return, hopefully. And I had written down something that I thought was so special, is that like you want, during that stage of menopause, you want to let go of what was, maybe the potential of maybe having more kids or whatever it is in your relationship that comes with regular childbearing years, and you move into what is. And it's a totally different relationship. It's a relationship that you have to focus more on shalom bayis. You're not going to the mikveh anymore. There's so many different changes that come into it, and it's like that cycle. We want to move into that. We want to move into that new space and allowing ourselves to like settle into that space. And we have to trust in Hashem during that time that everything is going to be good. You're going through a lot of different stuff. You have to just kind of let yourself, settle into it and know that it's going to be good. And then the very cool part is, as I was, discussing this over with my husband and just talking it through, and I was listening to the talk on menopause, and I said, this is brilliant. I said, when someone goes through menopause or osteoporosis, whatever it is, we have to take a pill. We have to do something to try to help ourselves. We want to have a cream. We want to have this because we want to work through it. What's the pill that Hashem wants us to take when our neshamos are going through change? The pill is emunah. Hashem wants us to have emunah and to trust in him and to know that everything that's going to be it's going to all be okay. Hashem is going to take care of you. We have to have emunah. We have to trust. Obviously, we have to do our ishtadlus. We have to take the pill. But that pill is emunah so that we can really allow ourselves to live. The anxiety and the worry and the stress all comes from that lacking of the emunah, because we're so worried because we're not trusting. And I've been through, we've all been through a lot of different things in life, but I can tell you that when you let go and you sit back and you say, Hashem, thank you for everything that you've given me. I'm going to take the pill. I'm going to take the emunah pill. I'm going to allow myself to just see what you're planning to do for me, what your plans are. It's very hard. I am saying this like, oh yes. It is a very, very hard thing to do, because our inclinations say, okay, but what about this detail? And what if this doesn't work out? And what if this symptom comes back and I'm so uncomfortable? But Hashem says, just take the emunah pill and let yourself relax and allow yourself to go through those changes. And then, that was really the biggest takeaway for me with this, is just like the transformation of our neshamos over time. And when we allow ourselves to relax and allow the changes to happen, I really do feel that Hashem like sprinkles something special over us and allows us to go. People have asked me, like, you've been through this and that and this in your life. Like, how'd you do that? Like, that's crazy, man. How'd you do it? And I'm like, I don't know. All I can say is that Hashem just sprinkles something on me that I'm just kind of like, okay, Hashem, like, we're just going to ride that train wherever it takes us, And so for anybody out there who is going through menopause or any changes in your life, just allow Hashem to take you and to let it go and to just follow wherever the path leads, because Hashem only does good. We just don't understand in our small little brains. We just don't understand. But that has helped me through so many difficult times in my life. And I continue to really use it as like, a parallel. And I hope that other people can really take the same too. And then the last thing that I really wanted to say was that for those of you out there who are going through menopause, it's really important to have a Rav that you're really close with, someone that you can ask shilos to. This is just me coming a little bit from a medical perspective. Sometimes, the blood or the differences that you might see when you're in menopause is different than maybe you were used to, and it might not be a problem. And so there are a lot of changes in your body that are going to be going on. It's always better to go to somebody who knows you and who also knows other people going through this. It's interesting. Working in medicine for many years, people say, how do you know that? It's like, it's such a rare case and this doesn't happen to so many people. How do you know that? And I say like, okay, yes, I studied, I learned, I've worked, but also I see this all day long. This is my area. So I know this because I'm doing this all the time. There's thousands of people in the world, but there's only, let's say, 3,000 people that I see all the time with this specific issue. So I know what to do. So find yourself a Rav who knows you and who understands what you're going through. So that way you could really help yourself through this process and not just be like pulling your hair out of your head because you just don't know what's wrong or what's up. And then to embrace the time frame of not going to the mikvah anymore, which is, there's a sadness there because the mikvah is such a beautiful mitzvah. To embrace that, just to kind of delve into working on shalom bayis, because the shalom bayis also changes because there's not that back and forth of mikvah, there is a change. And so I definitely recommend, I'm always very into like constant learning. No matter how much we know in life, we don't know enough, Yep. So I always recommend that my frum patients who are going through any kind of like body changes in terms of menopause, that they start taking some extra classes in shalom bayis to help strengthen them through this time, because it can be very like emotionally tumultuous.
That's a great idea. It's a really great idea.
Yeah, so those are my thoughts on this topic, and I have so much more to share, but I don't want to take too much of your time. So
I
thank
love
you
that
so
though.
much.
Well,
Yeah,
thank you so much. I loved everything you had to say. That was such a beautiful way to weave it into this really important topic that so many people had been texting me and calling me and asking me questions. And, I like to say, yeah, I don't really know enough. I'm an armchair expert. Like I learned a lot from the people that I've interviewed, but I don't have all the answers. And I realized this was a topic that really needed to be covered. And
yeah,
I love how beautifully you wove it into Torah and
thank you.
spirituality. It was really
Yeah,
beautiful. Thank you so much.
yeah, thank you so much.
This podcast is for informational purposes only. Please seek guidance from a trusted healthcare professional. By listening to this podcast, you release Holy Health and all of its guests from all liability. I'd like to thank Yakir Abelo for editing this podcast.